A new invention allows users to check their blood pressure with their camera phone. This comes amid increasing concern over a rise in hypertension and associated risks in Canada. The BP clip utilizes an ultra-low-cost plastic attachment that enables smartphones with cameras and flash to measure blood pressure. According to the Heart and Stroke Foundation, almost 8 million adults in Canada are affected by high blood pressure, or about 1 in 4, and more people are being diagnosed at earlier ages. Developers of the BP clip say because of the low cost of these clips, they can be easily handed out by doctors to those who cannot get regular checkups, thus allowing patients to check their BP at home regularly and with ease. Well, joining us now to tell us more about the BP clip is Dr. Edward Wang, Director of the Digital Health Lab at the University of California, San Diego. Dr. Wang, welcome to Forum Daily.
Hi, thanks for having me.
Now, I know there's a lot that is going into developing this BP clip, but in layman's terms, can you walk us through how this BP clip works and the demographics this invention could help the most?
Yeah, so the easiest way I like to think about it is that it's very similar to one of those finger trainers, right? The spring-loaded finger trainers, okay? And so I actually have the device here with me. And so essentially, I'll bring it close, right? And so as I squeeze down on it, if you think about it, there's a spring in there. And as I squeeze down, it applies a heavier pressure onto my finger. And much like how the cuff works on the arm, it applies a heavier pressure onto my arm, onto my finger, and thus cutting off the flow. And the job of the phone then is to supply the measurement, right? So the camera can see my finger through the clip. And some of the details of that, so my student, Tom, has wizardry on the optics, and he figured out this way of trying to measure the pressure by looking at the camera's distance from the finger using this trick where, so imagine this is what the camera sees of my finger. And as I press down on it, as you can see, this grows, right? The image becomes bigger. And so we leverage that by measuring basically the projection of that image onto the camera. As it gets closer and closer to the image, you can see the growth of that, of the finger, and thus measure the pressure. So it's this crazy optics trick that allows us to measure the pressure that's applied to the finger with such a simple clip. And then the rest of it goes into, we had to actually go into the hospital and collect a number of samples of people with different blood pressure ranges. And then we calibrated our system's algorithm to be able to use such a measurement to measure blood pressure.
And how does this device, the BP clip, compare to traditional at-home cuff-based BP monitors, especially in terms of accuracy and ease of use?
Yeah, so as I just said, the study we ran, the exact number is what we essentially came down to was 8 millimeters mercury and 5 millimeters mercury for systolic and diastolic. So those numbers roughly translates to this idea of let's say our device says you're 140, right? Then we're very confident that you are between 130 to about 150. That's the rough way to think about it. How does that translate to accuracy? Is that it's roughly good enough to be able to tell that you're hypertensive, right? That's sort of a layman's way of thinking about how good is that.
All right, doctor. Now, I know this device is still in the development phase. So what are the next steps in terms of really pushing this device out into the public?
Yeah, so there's definitely a number of it. First of all, this was a feasibility study where we showed that there's a level of accuracy that is useful. Now, the question is, how do we actually make this in a way where it's manufacturable for the masses, right? That it works on everybody's phone, and that when you use it in the morning, use it at night, it's the same accuracy. So there's quite a few different levels of improvements in the design, and also in performing a bunch more studies. And so we've started a company to try to actually take this out of the lab to go through the entire process of manufacturing and testing.
All right, doctor, just about 30 seconds left here, but if you could leave us with some helpful health advice, how often should people check their blood pressure and why is it important?
So I'm not a medical doctor, but it really depends on your condition. And it very much varies in terms of whether or not Say, for example, you are trying to understand your changes in your blood pressure with medication. Most people do once a day, maybe twice a day. The consistency is really what matters, what time of the day.